All right.
Welcome. I'm Howard Lux.
I'm Jeff Berg.
We are the two boneheads. We're two orthopedists. We have too much experience in orthopedic surgery, and we've been doing this for far too long. And we're bringing that experience to you. We're bringing up some interesting timely topics, and stuff you just need to know when you're injured and you're looking for another opinion. So today we're going to talk about SLAP lesions, or superior labral tears in the shoulder. What are they, Jeff?
Well, just as you said, so the labrum's a big ring around the glenoid, the cup. It's a point where the ligaments from the ball to the cup attach. And there's a top portion and a front portion and a back portion and a bottom portion. And SLAP tears are the top portion. When you get a tear in that location, right where the biceps attaches up on the top of the labrum, we call that a SLAP tear.
Right. So SLAP lesions, in terms of being a cause of shoulder pain, is there a specific age group that we think about?
Well, that's the challenge is in figuring out exactly when a SLAP tear is a SLAP tear.
Right.
It's just a normal finding. A lot of people, there's a lot of variation at the top of the superior labrum in it, and it can get a little tricky as to figuring out, is a abnormality up there actually a problem, or is it abnormal? And B, is it a cause for symptoms? Typically, in symptomatic SLAP tears, they're going to be in the younger patient. So
Right.
We're looking at primarily younger overhead patients.
Right.
SLAP tear in a senior patient is probably normal variation and probably almost always won't need to be treated.
I agree. So my thoughts on shoulder pain in an overhead athlete tend towards a superior labral tear or a SLAP lesion when there's pain in certain positions during the overhead motion. If you're 45, 50, 60 years old and you're walking in here with shoulder pain because when you're sleeping at night, or when you're reaching your arm up to the cabinet to get a glass of water and your MRI shows a SLAP tear, that's not the cause of your pain. It's a normal age variant.
Yeah, and that's the problem, right? Because MRIs almost always show some pathology around the labrum as we get older. And it can sometimes be we've discussed that here before. That's a hard discussion with a patient because the report says you got a tear up there and you have pain in your shoulder. So, how's that not the cause of my shoulder pain?
Exactly. Those are some of the most interesting talks and conversations that we have in the office. It's actually quite common for people over 45 to have a labral tear within the shoulder, most likely either related to old sports or simply wear and tear. By the time you reach 70, some cadaveric studies where they took apart the shoulders of people who had passed on showed that almost 100% of people had tears of the labrum. So it's important to try and put the injury into context. And as we've said before, treat the person, not treat the MRI finding. Now, if we have a young overhead athlete, say 18 to 20 something years old, and they are found to have a SLAP lesion and they don't respond to physical therapy, we consider fixing that, correct?
Absolutely. I guess the hard part, though, Howard, this, is even when you're in the shoulder, you're doing arthroscopy. Let's start in the beginning. Even looking at the MRI, the ability for the MRI to accurately determine a SLAP tear can be difficult. Sometimes the MRIs will overread them, sometimes it'll miss them. And so even that point's difficult. But once you get in the shoulder and you can actually do it arthroscopically and you look at the labrum and you can feel the labrum with your probe, it's still very hard sometimes to tell when the superior labrum is abnormal. There's variation up there, and it's interesting. I mean, these studies have been done, as you know, Howard, where they've, we go to our conferences and we look at big screens and they throw up images and you have people in the audience picking A, B, and C, which one's a SLAP tear. And orthopedists who specialize in this will vary. And so I think, at one point we're overcalling these, and hopefully the pendulum has swung back, that we're getting it right a little more right now.
Agreed. Where there's, I think, very little controversy anymore is if somehow you convince yourself that a slap lesion at 35 or 40 is the cause of pain, we're not recommending that we fix those per se. You know, a lot of people are now recommending a biceps tenodesis, which is an alternative procedure since the results of slap fixation over the age of 35 or 40 aren't very good. Do you agree with that?
Yeah. So my criteria for not fixing would be one that failed. The second time, I'll usually do a biceps tenodesis, and an overhead athlete with a slap tear. Sometimes I may just fix a part of it, but I don't want that to be too snug. There's some of those patients, if you fix that superior labrum, particularly in a throwing athlete, well, that can really affect their ability to throw.
Right.
And then in that older patient, you know, and exactly where that line is, I use 40, 45, you can use 35. I don't think we really know. And I think part of the problem is what I think hasn't really been teased out, at least my assessment of it is that maybe some of those things we've been calling slap tears weren't, and some of those patients get tighter. We know that older patients do get tighter with surgery. And maybe as we dial back and we try to figure out which ones are pathological and which ones aren't, maybe we will be able to repair more of them. But yeah, that's my criteria, sort of in line with yours.
I agree. And he brings up one very, very important point. And we're not really sure why it happens, but shoulder stiffness or tightness after having superior labral repair or slap repair is common, and it can be a big problem after surgery.
Absolutely. Yeah, I mean, that's, for me, that will be the thing I'll worry about most if I do a slap repair.
Agreed. So today we talked about superior labral tears or slap lesions. We got two boneheads, both Howard Lux and Jeff Berg, saying goodbye.
Have a good day.